The following podcast deals with panic disorder and was created in October 2015. It was created by Andrea Moore, a final year psychology student at the University of Limerick. Imagine you were at a shopping centre doing your weekly grocery shop. Suddenly, you were overcome by a feeling of dread and fear. You realise you are sweating, your heart is racing, and you are struggling to breathe. This experience is the everyday reality for many people who suffer from panic disorder. This disorder affects 1 to 2% of the population and is characterised by repeated and unexpected panic attacks. But what exactly happens during an attack? A panic attack is a sudden episode of overwhelming fear and dread. An attack can occur at any time, even during sleep. A person may also experience symptoms such as palpitations, shortness of breath, chest pain, and dizziness. The experience is so intense that many people fear they are dying, losing control, or having a heart attack. Many people experience panic attacks without ever developing panic disorder. For those who do, however, it can be a very debilitating disorder. It can be difficult to conduct daily activities, such as driving a car, going to work, or even meeting friends. In order to be diagnosed under the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, a person must meet certain criteria. Number 1, a person must have repeated and unexpected panic attacks for 1 month. 2, a person must worry persistently about having another attack or its consequences for 1 month. And 3, a person must display negative changes in behaviour, such as avoiding places where attacks took place. There are many theories about what causes panic disorder. One such approach is the cognitive model. This model suggests that panic attacks arise when people catastrophically misinterpret bodily sensations. For example, a person might notice their heart rate increase. This could be due to a variety of reasons. However, a person might immediately assume that they are having a heart attack, thus triggering a panic attack. As mentioned, this is simply one of many potential causes of panic disorder. Thankfully, there are many possible treatment options for those who suffer with panic disorder. Research has shown both drug treatments and cognitive behavioural therapy to be effective. The drug imipramine has been the most thoroughly researched drug treatment. It is part of a group of medicines called tricyclic antidepressants, or TCAs, and it works by influencing levels of neurotransmitters in the brain. Cognitive behavioural therapy, or CBT, is a treatment process that aims to identify and change negative thought patterns. Patients learn to perceive situations differently in order to influence their emotions. Psychologists Barlow, Gorman, Shear, and Woods carried out a study to compare these two types of treatments. Imipramine was shown to be more effective in the short term. While CBT was less immediately effective, the benefits were shown to be more long-lasting after treatment ended. The researchers found that a combination of these two treatments was slightly more successful. Thanks to research like this, we know that there are various treatment options for people with panic disorder. But how do we know which treatment works best? This depends on the individual case. A patient can discuss these and other options with their medical practitioner to decide what works best for them. If you or somebody you know is experiencing panic attacks, here are some tips. Remember that a panic attack does not last long. They usually peak in about 10 minutes. Engage in regular exercise. This has been shown to reduce symptoms of panic. Talk to somebody you trust or contact your GP for advice. To summarise, a panic attack is a sudden intense feeling of fear and dread, accompanied by physical and psychological symptoms. Panic disorder is characterised by repeated and unexpected panic attacks. There are many treatment options available, including drug treatments and cognitive behavioural therapy. If you have any concerns about your mental health, please contact your GP. This podcast is in no way intended for diagnostic use. For more information on panic disorder, try the following websites. Thank you for listening.
Created using Powtoon.